Vitamin D is also known as the calciferol, and it has many important functions as we will see. It is very important for the structure and development of bones, including teeth, and it also plays a major role in immunity. Vitamin D itself does not build teeth, but it controls calcium levels, which does build teeth. This is also true for bones and immunity. If you want to have healthy bones and healthy immunity, you need to have healthy levels of calcium, and you also need to have healthy levels of vitamin D. To have deficiency in vitamin D, you need to have one of two factors, either that you eat too little vitamin D or calcium from the diet, or that you are less exposed to ultraviolet light or the sun. Because vitamin D is activated by the sun, having less exposure to the sun, you will have less vitamin D activated in your body and you will have deficiency symptoms. Any conditions that affects the lining of the intestine will cause malabsorption problems, and this also affects vitamin D absorption. Most notably, vitamin D very quickly dissolves into the fat in our body and gets stored into the fat. So obese patients will have a lot of vitamin D stored into the fat and less vitamin D in the cells and in the circulation. Alternatively, if obese people lose a lot of fat very quickly, all this stored vitamin D will be released into the blood and they will have high levels of vitamin D. If you have deficiency of vitamin D, you will have one of two conditions that are the main hallmarks or characteristics of vitamin D deficiency. These are rickets and osteomalacia. To put it simply, vitamin D deficiency in children will cause rickets, and in adults will cause osteomalacia. Rickets is more serious, as in children the bone is constantly developing and growing, so if you have deficiency in vitamin D and calcium at that level, you will have many malformations all over the body, most notably bowed legs. And in adults this manifests as osteoporosis and bony pain. Like we said, ultraviolet light or sunlight is very important for the activation of vitamin D, but it does not affect the absorption or the levels of vitamin D in the blood. The levels of vitamin D are controlled by the food that we eat, and we find most of vitamin D in the livers, in salmon, other fish products like tuna and swordfish, dairy products, sardines, egg yolks, and fortified cereals. Again, these sources provide the vitamin D, but it has to be activated by the sun rays. The recommended daily intake is about 50 micrograms a day, and this can increase up to 20 micrograms a day if a patient was elderly. It is quite rare to see toxicity or high levels of vitamin D that can cause toxicity symptoms, but generally speaking, if somebody is taking supplements more than 4,000 international units, they will have some toxicity symptoms. And these include anorexia, weight loss, irregular heartbeat or arrhythmia, hardening of the blood vessels and tissues, and this occurs because calcium will be very high and it will deposit into these tissues. And of course, kidney stones. Use the link below to get access to the full Essential Vitamins and Minerals course. In this course, we will talk about all the vitamins, the minerals, their important functions, and deficiency symptoms. At the end of the course, you will be an expert in vitamins and essential minerals, as the course covers everything that you need to know.